Welcome, welcome, welcome in, everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything we do. Today's topic for our contact hour is the latest COVID variants and vaccines. We welcome everyone in today. I hope you're having a good Monday. Care Patrol, if you're unfamiliar with Care Patrol, is an aging care navigation service, meaning that we assist people who are in the midst of a healthcare crisis or journey, understand what's next in the continuum, who the best providers are, what these things cost, and if needed and when needed, we tour with clients and interview providers together to help them feel confident in making the best decision. And all of this is done at no charge. The majority of our clients, 60% or more, are folks from whom we'll never see commission, but it is for us a mission as much as a business, and we appreciate your support of Care Patrol and of us. The latest COVID variants and vaccines is our password today. We appreciate everyone making time to join us. We are accredited by the Alabama Board of Nursing and also by the Alabama Board of Social Work to provide 1.0 contact hour for this course. This hour-long course is considered live by the Board of Social Work because we use a password-protected online evaluation program. We give the password at the end today, and then that ensures to the board that you set our folks sit for the entire hour, thus making it like a classroom. We do encourage discussion and hope you'll use the chat room to say hello to one another or ask questions or correct me when I'm wrong or answer any other questions or anything at all. If you're not familiar with the chat room, if you're new to Zoom, put your your cursor up to the top of your screen. A black bar should pop down, and on that is the word chat. If that doesn't happen, just move your cursor to the bottom of your screen and it will pop up. Click on chat and join the discussion. Our evaluation, as I said, is online and it is password protected. I am going to read to those of you who may be not seeing a screen, but rather working at your desk or eating lunch or driving from appointment to appointment. So those of you who are able, hello, Miss Jackson, welcome again. For those of you who need to know or write down or make note of it, our evaluation link today for latest COVID variants and vaccines is https://www.surveymonkey.com/lowercase r/ all uppercase letters here 9 T as in Tom, Q H G as in girl, W X. That's our online evaluation. I have also posted it again in the chat room for everyone to have at their disposal. And remember, the password's given out at the end of today's presentation. Everyone must do an evaluation in order to receive credit for this hour. I'll be emailing everyone who does so your certificate as well as this presentation for your use. And you must do the evaluation. Again, hello, Ms. Johnson. Good afternoon. We will also be uploading for nurses this contact hour within the week to the Alabama Board of Nursing website. Let's get started. This is a big topic, I have to admit, and I feel like, in fact, maybe bigger than me, but you'll have an opportunity to make note of that in the evaluation, which I hope you'll do. I hope you'll get credit. Our objectives for this hour for latest COVID variants and vaccines is objective one. We're going to relive, unfortunately, the exhaustive history of COVID worldwide. Our second objective will be to learn the most important COVID vaccines to date. Okay, and there have been several. And then lastly, our third objective, we're going to detail some of the new COVID variants that are looking to take hold perhaps this fall. Let me let some folks into the presentation. So I want to ask y'all then, has the COVID emergency officially ended? Has the COVID emergency officially ended? Hello, Miss Perry. Good afternoon, everyone. Miss Siggers says no. Miss Grant, Miss Lampkin. Christina Wood says, yes, it ended in May. And Darla Dean says, well, as far as the feds are concerned, it in fact has ended. And I have to say, Miss Dean and Miss Woods, you nailed it. Now, we know COVID-19 is one of the deadliest outbreaks and pandemics in our modern history. But on May 11th of 2023, the United States officially downgraded this national emergency status for COVID after it claimed nearly 7 million lives worldwide. Deaths from COVID in the U.S. exceeded 1.1 million people. 1.1 million people, nearly twice as much as the death toll in the United States from the 1918 flu pandemic. And you all remember, as we were in the early days of COVID, the Spanish flu, 1918 flu, was very much in the news as being something we hoped we would not achieve. And as we all know, COVID-19 took a heavy toll economically, politically, and psychologically. And it revealed not only fissures, but deep divisions in the ways that Americans view government, public health, and particularly mandates around vaccines or other safety measures. And I think we could all agree that COVID will reverberate with us for decades. And reverberate, not only reverberate, COVID has changed the United States, it's changed the world. And these changes, I don't think, will soon be outdone, if ever. So y'all may recall, and I said we're going to exhaustively relive this history. And I have to say here, y'all, my apologies, but this is a huge topic. And I really had trouble wrapping my brain around it. So I hope you'll bear with me, and please interject when possible. Again, I like to hear y'all's voice. I like to hear your opinions. I appreciate your experience. And I know that I'm not alone. I know that others who are on this call appreciate your experience too. So please jump in and throw me a lifeline. In December of 2019, the Office of the World Health Organization, the China-based Office of the World Health Organization, received news of an isolated outbreak of a pneumonia-like virus in Wuhan, China. And the virus was known or was observed to cause high fever, shortness of breath, and all of these cases seem to be identified as originating from the seafood wholesale market in Wuhan, and that was closed on January 1. So 13 days later, after the first incident to report, the believed source was closed, and China informed the World Health Organization that they identified 40 cases of this pneumonia-like disease. Sorry, I'm letting someone in. On January 3rd of 2020, so about 15 days later, the WHO identified this novel type of virus as a novel type of coronavirus, which is very similar to the SARS virus. Now, some of you who are a little older may remember the SARS virus that swept through Asia and Southeast Asia in 2002 to 2004. Now, who named this new strain after that as SARS-CoV-2? Severe acute respiratory syndrome coronavirus, excuse me, 2. Can you I believe I did. Yes, ma'am. First Chinese victim of this SARS-CoV-2 died on January 11th, of 2020. Now, where this virus actually originated is fairly hotly debated. And there are two theories. One is that the virus jumped from animals to people, possibly carried by infected animals brought into this seafood market to be sold. And the other belief is that the virus escaped from the Wuhan Institute of Virology. That this perhaps was, perhaps even a weapon that was being studied. And the U.S. Intelligence agencies say that actually both of these are plausible. Yes, it may very well be animal to human transition, or it may be human to human warfare. What do you believe, y'all? What do y'all believe? Do you believe that this originated in a seafood market transmitted from animals to people? Or do you believe that this was a mistake made by the virology office in Wuhan, China? Does anyone have a thought? Anybody believe one or two or both? As y'all mull that over and look for the chat room here, Ms. Dean, personally, I believe this was a matter of hygiene from a foreign market. That's an interesting theory. I hadn't come across that. A matter of hygiene. That's an interesting way to put it. Anyone else agree with Ms. Dean or have a different feeling about the origin of coronavirus, or are you of the opinion that it's here and that's really all that matters? The World Health Organization hoped that this Wuhan outbreak would be confined to Wuhan. But shortly after, by mid-January, in fact, of 2020, there were now infections being reported in Thailand, Japan, and Korea. And all of these reported infections were related to people who had traveled to China. I agree with Ms. Dean. Thank you, Terry Jones, for joining the discussion, and others. I hope you'll jump in. I do love it when people share with one another and with me. Ms. Siggers, I agree with Dar, but I also believe the hygiene practices here in the U.S. How interesting. But I agree that it originated at the wet market. Ms. Siggers says, Dar. So here we are, January 18 of 2020, and a 35-year-old man returns to Seattle from China. He's experiencing fever, nausea, vomiting. Anybody remember this feeling? On January 21, he was identified as the first American who had contracted the SARS-CoV-2 virus. Darlene, open crowded air markets with live animals sold for consumption. I think there's a lot to that. There have been many such instances of viral outbreaks in which we could see a direct correlation. The HIV being maybe the most prominent. In January 26th, then, 8 days later, U.S. had 5 cases. And it was believed after the fact that dozens of Americans, in fact, had contracted this weeks earlier, but we didn't know what we didn't know. And so one of those died February 6th. So the first American death by COVID was February 6th of 2020. And the first American casualty, well, that can't be the truth. Those two statements are invariant. Excuse me, y'all. I pull information from different sources, and sometimes I miss something, and I apologize. So in January 30 of 2020, the CDC confirmed then Centers for Disease Control in the United States, virus had spread between two people in Illinois who had no history of travel. And this was the first recorded incidence of person-to-person transmission in the U.S. And on January 30, 12 days after the first case presented, there were now 7 cases in the United States. On February 11th, the World Health Organization released a new name for the disease, the coronavirus disease 2019, or COVID-19. February 13th, America saw its 15th case. March 3, 60 cases, only 21 of which were in any way travel related. By mid-March, all 50 U.S. states had a positive case of COVID-19. And the CDC launched a website to assist people to find critical care, given that they assumed, and they were correct in the assumption, that there would be coming ventilator shortages. March 16, 2020, 114 countries worldwide are experiencing COVID-19. 4,000 people had died and hundreds of thousands infected. March 11th, the WHO had officially declared COVID-19 as a pandemic. So in March 31 of 2020, my birthday, the White House briefing that's become fairly infamous now, which Dr. Fauci and Dr. Birx announced that they believed that there could be as many as 240,000 deaths in the U.S. due to COVID-19. Now, on April 10, there were 18,600 confirmed deaths and 500,000 confirmed cases in a 4-month span. The United States, 18,600 deaths. And really, at that time, the U.S. became the country with the most reported COVID-19 cases and deaths. Now, I put an asterisk by that because it is the most reported. But nonetheless, the 159,937 cases confirmed in New York at that time surpassed the number in Spain, in Italy, and in China. In fact, almost doubling the number in China. April 16, 2020, President Trump undercut the advice of Drs. Fauci and Birx and suggested that masking need not be voluntary, and that, in fact, he was not going to wear one. And he released a plan that day outlining for states that wish to reopen how to do so and what benchmarks to hit. Now, this was the beginning, I believe, of the political divisions that hobbled COVID-19 response in the early days and hobbles our political environment today. In April of 22, this is interesting to me, 2 pet cats died in New York in separate areas of the state, showing that it was in fact, zoonotic disease transmissible from animal to human, as was proposed by the World Health Organization office in China, in Wuhan. And just about 6 months later, or 18 months later, 400 different animals had contracted COVID-19. And I can remember a very high number of people having distress about the possibility of their pet doing so. April 24 of 2020, 8 days after the president's announcement, Georgia, Alaska, and Oklahoma partially reopened. And on April 28th, this is a sort of sideshow, but polls were showing that those under 30 years old or who made less than $40,000 a year were not seeking medical care when the existence of COVID might be in play with them. And this, of course, leads to an underreporting, which again hampered the ability of a response. Now, this is a much bigger issue than simply COVID. It's healthcare in America. But the other thing that I think is notable about Trump's sort of wavering response in many ways was that he had suggested that hydroxychloroquine sulfate and chloroquine phosphate would be helpful in holding off or even curing the disease, and had asked for donations to be given to the Strategic National Stockpile. Well, on June 15th of 2020, the FDA said, actually, this is not true, and we don't really need it. Ms. Dean, which supports the ideology this originated from an ill animal sold in an open air market. Yes, ma'am, that is my point. So social unrest naturally was on the heels of political division. Now, the CDC was showing that about 10 times more infections had occurred than reported in March 2020 to May 2020, this span. And depending on the region, that could be as many as 6 times or as many as 24 times more cases than reported. July 14th, we remember this day, each of us, many of us still masked. The CDC suggested mask when leaving home and called mask a critical tool in the fight against COVID. August 17th of 2020, about 4.5 months after the first case, or first death rather, COVID-19 became the third leading cause of death in the US. We all remember this. Deaths at that time in the United States exceeded 1,000 people per day. And there were cases reported nationwide of over 5.4 million. Florida, Texas, Oklahoma, Mississippi, North Carolina, South Carolina, and Georgia all had the distinctions of having the greatest percentage of adults uninsured and the highest numbers of new cases. This goes back to my earlier statement about underreporting. So it wasn't necessarily, in my opinion, that this was some sinister cover-up. Instead, I think it was a natural extension of the lack of health care in the US. And naturally, if people aren't seen, they can't be diagnosed, the case cannot be reported. But nonetheless, in January of 21, in fact, January 21 of 21, the Biden administration announced a national strategy that seeks to restore trust in the government and in public health, so that vaccinating, testing, and treating COVID can be done effectively while at the same time protecting schools and businesses and workers. And Biden referred to this initiative, this strategy, as a wartime undertaking. Think of that, describing a pandemic as a wartime undertaking. That shows you the gravity. If the numbers didn't do it earlier in this presentation, that statement should show you the gravity of a COVID response. So I want to ask y'all if you were or still are opposed to the COVID-19 masking and vaccine mandates. Was your opposition mostly political, or was it mostly medical, or mostly something else that I didn't identify, maybe common sense or practicality? Please share. I'd love to hear folks' thoughts on this. If you were or are opposed to the mandates and masking, would you say that your opposition is mostly political or mostly medical or practical? Mostly, mine was medical, Ms. Talbert. And I think I've heard this story from you. I believe you had you were immunocompromised, if I remember. I may be wrong. Please don't let me put that on you if it's not true. So then the history of, hello, Ms. Brown. Lupus, I remember that. My daughter for many years was thought to possibly have lupus. And of course, because she's not yet 26, she may still be diagnosed. A new vaccine typically takes about 10 to 15 years to develop and to test. But under Trump, the U.S. Department of Health and Human Services launched Operation Warp Speed which was $1 billion investment with pharmaceutical companies to rush this formation of a vaccine, a very, I think, very effective public-private partnership. The first clinical trial was announced on March 16, 2020. I mean, this is just really at the same time that we're hearing about the possibility of something called COVID. These vaccines, the first developed vaccines, were by Moderna and Pfizer, and they were the first ever to employ messenger RNA, which is a breakthrough technology. And after large-scale clinical trials, not only at that time, but continuing to this day, both vaccines are found to be over 95% effective against COVID-19. Oh, it's Keldon Jones. Welcome in, Keldon Jones. On July 22 of 2020, the Department of Defense reached a deal with Pfizer BioNTech for 100 million doses of its new COVID vaccine. And on August 11th, the Trump administration paid another $1.5 billion to Moderna for 100 million doses. September 14th, the biotech phase 3 clinical trials brings its vaccine to 44,000. September 16, the Health and Human Services Department announced a plan to make COVID-19 vaccines free. Johnson & Johnson begins phase 3 clinical trials with 60,000 participants on September 21 of 2020. And on December 23, the Trump administration purchases 100 million more doses of the Pfizer BioNTech vaccine. We're talking in the span of months, billions and billions and billions of dollars directed at this anomaly, this viral anomaly. Let's see if I can change pages. Now, on December 14th of 2020, about 9 months after the pandemic really first got going, Sandra Lindsay, a nurse in New York, became the first American to receive a vaccine for COVID-19. Just 10 days later, over 1 million vaccines have been administered, starting with healthcare workers naturally, and also including the elderly, particularly those who were residents in nursing homes. Vaccine availability was then extended to all Americans. You all remember this tiered system, and then to teenagers, and then to school-aged children. And by the end of the pandemic in March, as y'all pointed out earlier, over 670 million doses. Over 670 million doses have been administered in the US. That's about 203 doses per 100 people. And it's about 80% of the US population that has received at least one COVID-19 shot. And here is something we'll touch on a little later, but it stands to be a truism in healthcare. Vaccination rates were markedly low among Black, Hispanic, and Native Americans. We'll get back to that. I want to ask y'all, when did you receive your first COVID vaccine? When did you receive, and I know, Ms. Talbert, you didn't, but of those of you who did, when did you receive your first COVID vaccine? Ms. Carpenter, you have not. And did you answer the question as to whether this is a political belief on your part or a medical belief on your part? May 21 says Charmel Garrett. Anna Clardy says she was the first in March. These are coming in quickly. After Johnson & Johnson came out, 12/31/20. First Johnson & Johnson, early February, August, July 21, March 21. Ms. Johnson, you're not vaccinated. Thank you all. I love it when y'all participate. It makes me feel like I'm reaching you, and this is a good use of your time. So as we were talking about the early histories of the COVID response, we have to say again that pandemics are expected. Pandemics are expected in a globally interconnected world. And this is a little frightening and sobering, but it's true. So emergency plans had already been put into place. However, these were put into place for a supposed coming flu pandemic. But nonetheless, plans were underway, as y'all remember, very quickly. State by state, city by city, emergency measures encouraged social distancing, restricted travel, closed churches, schools, and businesses, and only essential workers could move about freely. This was prison for many of us. By early April of 2020, over 316 million Americans were at home. And there were, by that time, more than 1,000 deaths and nearly 100,000 cases. And the issue here is that public health officials didn't know what to do. They didn't know what they didn't know. They knew what to do in terms of managing a pandemic. They didn't know what to do in terms of managing this disease. And there were so many. Miss Talbert said you were hesitant about the vaccine because of the Tuskegee experiment. And that's so true, I think, among the Black population in the South for sure, but across the country is, medicine has not treated Black Americans kindly, using them as guinea pigs and experiments, as the Tuskegee Institute or Tuskegee incident shows. It's a real disconnect, and it is, as we've discussed many times in these courses, a real problem in healthcare in America. But I rely on you, those of you who are on the front line. It's you who can change this, you who can be aware of this, you who can make a difference. Let's see, we're on the next page. I'm sorry, I got off on a soapbox. Well, we know what happened economically when the pandemic happened. It gutted our economy in the U.S. It gutted the worldwide economy. In fact, on June 8th of 2020, this is early on, y'all remember, the World Bank states that the pandemic will cause the worst recession since World War II, and it very nearly did. Early months of COVID-19 pandemic, billions of people worldwide were out of work, fretting over toilet paper, stuck at home. The U.S. share prices of the New York Stock Exchange fell so quickly at the advent of COVID that the exchange shut down trading 3 separate times. The Dow Jones lost 37%, and the S&P 500 lost 34% of their value quickly. The unemployment rate skyrocketed, and as we've seen, even persisting until today, that unemployment rate, it remains high for service type personnel, people who work in restaurants or other retail establishments. In May of 2020, the U.S. unemployment rate was 14.7%, the highest since the Great Depression. Ms. Clardy said, I started my MSW program in August 2020, and it was insane to see how our entire schooling revolved to an extent around the pandemic and the future of social work. That's so fascinating. I bet you enjoyed that immensely. Ms. Jones, I was hesitant due to daily fluctuations from the government as a health. Well, that is true. And I think we've touched on that a little bit. I don't think vaccines should be mandated. Someone said, I didn't catch the name as it's rolled over, Ms. White. Anna Clardy says it's very interesting to watch the Tuskegee commercial for the vaccine. They got actual survivors to speak on it. Ms. Jones says, I'm fully vaccinated now and never got it as a healthcare social worker. How interesting. So the history then of our COVID response in the U.S. would be that on August 26th of 2020, Abbott's Binax Now COVID-19 test became available and could detect infection in 15 minutes, the same technology as Abbott's flu test. Do y'all remember this day? I remember this day very clearly. Sorry, one minute. In November 23, Regeneron was significantly shown to reduce the level of sickness of COVID-19 within days. Now, on September 22nd of that year, the reported death toll in the US surpassed 200,000, over a million worldwide in 10 months. That's 100,000 more deaths in 1 month than the months leading up to that. December 27 of 21, the isolation period was shortened. We remember this. Hooray, hooray. And on March 30 of 2021, the recorded deaths in the United States due to worldwide, due to in the US, COVID-19 deaths, I'm sorry, y'all, on March 30 was 976,000 people. And there were over 7,900,000 total cases, 79 million. I'm having trouble, y'all, today. I do apologize. Now, do you remember, as we've been discussing this and you've been bringing your thoughts and experience to bear about that time, do you remember how you were feeling? In fact, maybe just distill how you were feeling into one word: anxious, confused, angry, worried. How are you feeling as the events that I've just described transpired? And this was not so long ago, and yet for me, I have a real block thinking about that time. It's almost like it didn't exist in a way. Does anyone else have a sense of how you were feeling then, maybe how you're feeling now? Has it changed? Please share with us in the chat room, share with your colleagues and me. We all appreciate your thoughts. Now, as I've touched upon here and there, social unrest certainly came on the heels of and as a cause of, or an effect of, rather, the pandemic. This heightened our political contentiousness in the US, and it heightened social upheaval in the US. And this was most illustrated when George Floyd was killed by the Minneapolis police on May 25th of 2020, just about 2.5 months since we first began hearing about COVID. This energized the Black Lives Matter movement. You remember this? Energized. And it was in part because the protest was successful, in large part because so many who took part were out of work or home from work or home from school due to shutdowns. So an unprecedented number of Americans in history now took to the streets. Ms. Carpenter says, in disbelief that all the deaths were actually due to COVID. Afraid and stressed, says Ms. Brown. Ms. Dean, I was and still am filled with anxiety. I'm old, fat, and primary caregiver for aged parent. I would hate to give her a communicable disease. I know I have the same feeling about my mother, who's 87, and my wife had COVID about 2 weeks ago for the third time. And so, I even though I think the mandate has changed, I stayed away for 5 days because I'm so interested or so concerned rather about that. Now, Miss Jackson had a good question for y'all. Thank you, Andrea Jackson, who says, I am curious as to how many got COVID after vaccination. I still have not had COVID. How many of y'all got COVID even though you were vaccinated? So here's what I find most interesting. In the weeks following the Black Lives protest, and I won't get into the political division there, but in the weeks following that, there was no evidence of a spike of COVID-19 among the general population. Ms. Craddock has twice had, and Kathleen Young twice. Mom, fully vaccinated, had COVID 4 times, got COVID between first and second shots. Never had COVID, nor my husband. I was very concerned. Hand washing practice. I'm sorry, these are coming in so quickly, I can't keep up, y'all, but do pay attention to the chat room and the thoughts of your friends and neighbors. But what concerns me, and again, why I think this was a time of division, is that instead of banding together, as we rightly could have done, to combat this pandemic, this wartime effort, if you believe, we became more divided along political lines, mostly in opinions of masking and vaccines and social distancing. In general, politically liberal Americans favor mask and mandates and vaccines. And in general, politically conservative Americans are opposed to mask and vaccine mandates. I love this discussion, y'all. Keep it up. Now, here's what we should also take note of with COVID. And to someone's earlier point, deaths from COVID need not be necessarily deaths from a respiratory disease. They can be related deaths due to any number of factors: transportation, food, durable goods, water. And do y'all know now, this is interesting, about 30% of US sewage systems have coronavirus in them, detectable levels. Food insecurity reached its peak in December of 2020 following the advent of the pandemic, when 30 million Americans, that's 14% of us, reported that they hadn't had enough to eat. They and their family had not had enough food in the past week. And so the economic effects, like the health effects, were not equal, as you might guess. Black and Hispanic and Native Americans suffered greatly and more so from unemployment and food insecurity than their white counterparts. Congress, as y'all remember, authorized COVID-19 relief packages in 2020 and 2021, and each of us received a stimulus check, maybe more than one. On February 18th, 2021, an estimated 2.5 million women and 1.8 million men left the workforce or had left the workforce since the start of the pandemic. And on May 17th of that year, 1.3 million of an estimated 5.1 million who had left the workforce when COVID-19 closed schools and childcare remained out of the workforce, and only 50%, 56% of the women who were working for a salary had been able to find work and return to salaried work. This is the lowest since 1986, y'all. March 14, 2022, China locks down again due to the new variant, Omicron. Tens of millions of Chinese stay inside, and key technology manufacturers close. Production and distribution of goods is disrupted worldwide. For example, do you remember the chip in automobiles or the chip in the iPhone and how this slowed progress? In June 10th of 2022, the global market for N95 masks is predicted to reach 11.8 billion by 2026. Now, would y'all have ever imagined, who wear masks quite frequently, that masks would be one of the greatest expenditures we have in healthcare? Mask. Well, how did the COVID-19 shutdown affect your workplace? Is it back to normal? I'll just hope you all talk with one another, talk amongst yourselves. The toll of COVID then is that by August 17th of 2020, again, about 4.5 months after the outbreak, COVID-19 had become the third leading cause of death and nationwide cases by then were exceeding 5.4 million. COVID-19 impacted all of us, but those who died, again, were likely to be older and people of color. In fact, of the over 1.1 million COVID deaths reported in the US to date, 75% were believed to be 65 or older, 93% 50 or older. And throughout the emergence of the variants and vaccines, older Americans have remained the most at risk for hospitalization and ultimately dying. October 6 of 2021, the food insecurity in the U.S. reached 52 million people, 17 million more. October 7th, then naturally, the CDC adds mental health conditions to the list of risk factors associated with severe illness from COVID-19. And again, this is a COVID-19 related factor. Do y'all know that deaths by firearms in the US went up 19% between March and April of 2020? About March 20 to about April 20, 19%, y'all. And these were largely suicide. So the CDC adds mental health conditions and the anxiety, we know, even still, of contracting the disease, the stress of maybe being unemployed again or confined to home again, leads and has led to unprecedented feelings of depression in the US and loneliness. We did a session on the loneliness epidemic, which touches on this. You can see it on YouTube. Just go to YouTube, put in the search bar, Sean Barnes Care Patrol, look for my page. There's about 80 to 90 CEUs there, which you can take and get recorded credit. And then on March 2 of 2022, then the WHO data, World Health Organization data, shows a 25% increase in anxiety and depression, with the young and women being the highest risk. Well, y'all, I'm having troubles here. There we go. The COVID-19 pandemic shined light. Wasn't the first light, it was just another light on the health disparities between racial and ethnic groups, which we know, unfortunately and realistically, to be driven by systemic racism and also by lower access to health care. Black, Hispanic, and Native Americans are at a higher risk of developing life-threatening COVID-19 and dying, twice as likely to be hospitalized, and American Indians and Alaskan Natives are at the highest risk for developing a severe form of COVID-19. In March 17 of 2021, the CDC allocated $2.25 billion to serve these populations, including those living in rural areas. And on April 8th of this year, the CDC director, Dr. Rochelle Walensky, released a statement on racism and health amid COVID-19, in which Dr. Walensky says the disparities seen are not a result of COVID-19. Instead, inequities that have existed for generations and revealed for all of America a known but often unaddressed epidemic impacting public health racism. Y'all, we're not going to finish this today, it looks to me like. So let me do this. Let me get through one portion, and I'll go ahead and book a second portion of this for next Friday. Next Friday, we'll conclude with this. You'll get credit for 2 hours if you see 2 sessions, 1 hour if you decide you'll only stay today. But as I said, this topic has gotten bigger than me, and I haven't even touched on the title yet, which is the latest in variants and vaccines. And I don't want you to be left behind if that's why you tuned in. So let me just say that I will continue this presentation at another date. I will include a link in the evaluation in the link that or in the email that I send pending the evaluation. So if you want to be here, I'll both send a link about the second presentation in an email blast, as well as in the email you receive tomorrow. Let's continue. On July 20 of 2021, 1.5 million, over 1.5 million children worldwide lost their primary and or secondary caregiver due to COVID-19. January 3 of 2022, nearly 1 million new COVID-19 infections in the US due to the Omicron variant, which was the highest in any country in the world at that time. The number of hospitalized patients rose 50% in 1 week in January of 2022. By March, over 90% of the US population was in a location with a low or low transmission level. And the US at that time had donated over 480 million vaccine doses to 110 countries. This is us doing a good thing, y'all. March 10 of this year, or rather of 2021, World Health Organization reported 6,019,000 confirmed deaths, 450 million confirmed infections. By March 24, the CDC said that deaths between 2019 and 2020 increased 19% after the pandemic onset, the largest in 100 years. The same percent. So March 31 of 22, the CDC showed that high school-aged adolescents, 44% reported more feeling persistently sad or hopeless, 55% reporting emotional abuse in the home, 11% reporting physical abuse in the home, and 29% reporting a job loss by an adult in their home. By April 22nd, for the second year in a row in 2022, COVID-19 was the third leading cause of death in the US after heart disease and cancer. On April 27th, there were delays in measles vaccinations, back to COVID-related deaths. April 27 of 2022, delays in measles vaccinations were caused by delays and shortages due to the pandemic shutdown due to COVID-19. And so a nearly 80% rise in measles cases has occurred worldwide. May 5th, World Health Organization estimates 15 million direct or indirect deaths globally from January 2020 to December 2021. And the largest of these were in Southeast Asia, Europe, and the Americas. By May 12th of 2022, US deaths reached 1 million. May 16, CDC announced that 50%, no, it was a journal announcement that said 50% of the COVID-19 deaths in the US were vaccine preventable. Vaccine preventable. Just say it. May 25th, CDC data showed that COVID-19 survivors, those who had it, are likely by 2 times likely to develop a pulmonary embolism later in life. 1 in 5 adults have at least one health condition attributable to the COVID-19 infection that they received and suffered through. May 28th of 2022, the average new US COVID-19 infections were 6 times higher than a year before. There were 119,725 new cases each week, compared to 17,887 in 21 when we were shut down. By June 1, 2022, US reported 84 million COVID infections and 1,003,571 deaths. So in other words, in a span of 19 days, 3,571 people died due to COVID. And so I want to ask y'all, we'll end the day here. But I want to ask y'all which, and I will, as I said, send out a link. Which COVID vaccines have you received? And I think y'all said this earlier, so don't spend too much time on this unless you didn't answer them. We'd love to hear you. We'll get into all the vaccines, not this Friday, but next Friday. We'll get into all the variants, latest vaccines, etc., as promised. Moderna for 4 vaccinations. Moderna, Pfizer. And I will forward the link, y'all. But let's go right now and just go to give you today's password and, oops. How did I do that, y'all? There we go. So today's link, one more time, for those of you who did not catch it earlier, our evaluation is online. You must do the evaluation to get credit for this hour. This is 1.0 hour for nurses and 1.0 hour for social workers, as determined by the boards of nursing and of social work for the state of Alabama. The password, which is password protected, is Omicron, and the link is https://surveymonkey.com/all uppercase letters, starting with 9, T as in Tom, Q, H, G as in girl, W, X. And the password again is Omicron. Omicron. That's capital O, MICRON. Omicron is today's password. You must complete the evaluation to receive credit, at which time you will also receive a link to next Friday's conclusion of this topic, and you'll also receive this presentation after next Friday when I'll send it to you. Thank you so much for being here, and thank you so much for your patience with me. Sometimes I struggle, and you've been very supportive today, and I very much appreciate you. Nurses will be uploading this hour for you to the ABN website. Social workers will receive a certificate in which you can handwrite or type in your name. This is a live presentation for you social workers because of our password protected evaluation, which again you must complete to get credit. I'll send out the email tomorrow. Thank you so much, and thank you, Ms. Clardy, for posting the password. Thank you so much, everyone, and thank you as always for being here, and thank you for what you do today and every day for other people. You are servants, public servants, and I thank you. I hope everyone has a wonderful week. Join us next Monday when Dr. Nicole Brown, Doctor of Social Work, will surprise us with a topic of her choosing that is chosen from a list that you all, as former attendees, created. So it will be definitely something that the people asked, but I don't know what yet. But please join us on Monday of next week. Have a great week, and I look forward to seeing you all again very soon. Well, here we go.